Children do not often suffer heart attacks like adults. Instead, major problems in children relate to breathing. But if a child's breathing problem is not cared for promptly, cardiac problems can result. Before providing care, assess the child's condition. Always handle any immediate threats to life by checking responsiveness and breathing. When approaching a motionless child, tap and shout to see if there is a response. Victims who can speak, move, or react are described as responsive. Victims who do not respond are considered unresponsive. While checking responsiveness, also look at the chest to see if the victim is breathing. If the victim is unresponsive and not breathing or only gasping, CPR is needed as well as more advanced medical care. Ask a bystander to call the local emergency number, usually 911. If you are alone with an unresponsive, non-breathing child, perform 2 minutes of care. Then make the call to 911 yourself and return to care for the child. CPR is a combination of chest compressions and rescue breaths. Give 30 chest compressions in about 18 seconds. Chest compressions can be given with 1 or 2 hands to compress the chest about 2 inches. After 30 compressions, move to the child's head. Tilt the head back and lift the chin to open the airway. This action moves the tongue away from the back of the throat in an unresponsive child. Pinch the nose and give 2 normal breaths. Each breath should last about 1 second and make the chest gently rise. You may want to use a breathing device during rescue breathing, such as a face shield, if available, to help prevent the possibility of disease transmission. Repeat cycles of 30 chest compressions and 2 rescue breaths until an automated defibrillator is available, until the victim is revived, until you are relieved by someone else capable of performing CPR, or until you are too exhausted to continue. Whenever an automated defibrillator, commonly called an AED, is available, stop CPR and use the device. Apply the AED pads to the victim and follow the prompts of the device. Use pediatric pads if they are available for the device. AED use is explained in a later section of the program. If a breath does not make the chest rise, retilt the head and try another breath. If still unsuccessful, assume the airway is obstructed and give 30 chest compressions to dislodge the obstruction. Look for an object in the mouth and remove anything visible. Reattempt breaths. This is usually all it takes to dislodge an object and clear the airway.